Both audits showed that there were issues in planning and stockpile management before the pandemic. For example, in our audit on procuring personal protective equipment and medical devices, we found that before the pandemic, the Public Health Agency of Canada had not addressed long-standing known issues with the systems and practices used to manage the National Emergency Strategic Stockpile. So if you're asking me today, have they addressed those longstanding issues? The answer would be no. What we saw them do was work around those issues and shortcomings in order to mobilize a response to support provinces and territories throughout the pandemic. So there is the need now to deal with these issues post-pandemic and to consider how to ensure that there's flexibility. So, I mean, the first place is what's your baseline stock of what kind of equipment you should have? And then how do you ensure that you can maintain that? What system do you need to support it? And how do you ensure that agility and flexibility is baked in to processes going forward? Well, I'm not sure that anyone can predict when the pandemic will be over and what that 1 year from the pandemic will be. I do recognize that everyone right now is focused on continuing to meet the needs of provinces and territories as we are still very much in the middle of a pandemic. How do you go about addressing that? Well, I think the first thing is that you start off on determining how much of certain elements you should have in a stockpile for protective equipment. For example, N95 masks were very important in an airborne illness like COVID-19. That might not be the case in the next health emergency. So you do need to establish threshold of the baseline of equipment that you should have in your stockpile. Then it's making sure that you've fixed your system to properly track it, that you've properly funded it, and that you've built in some flexibility and access to additional warehousing, additional supplies, increasing Canadian domestic capacity. There's to manufacture these things. There's so much that needs to be done to be better prepared, but it starts with establishing that baseline of what you might need in the stockpile for an emergency across the country.